Effectively, we're building a model in which we have nurses that are very experienced, help case managers support injured people that are particularly complex from a medical perspective and from a psychological perspective. We know that the role of the case manager has a lot of demands on it, and they don't typically have the time. They may lack the training to be able to do that work effectively, and this is where the nurses come in. That's the new component.
So I have welcome Cassie and Misael from Honeysuckle Health. Now, straight off the stage after your presentation at PIEF Conference 2024, congratulations. We'll talk a bit more about that in a moment. But just quickly, what's Honeysuckle Health?
Well, maybe I'll take this on, Misael. So, Honeysuckle Health are a health services organisation, but we're here to help people lead healthy lives by connecting them with effective and affordable healthcare.
And operate throughout Australia?
Yeah, we actually do, which is great. So, we've got a national footprint operating in every single state.
And how long has Honeysuckle Health been operating?
So, we're coming to our 5-year anniversary in December.
The anniversary.
Thank you.
Now, your presentation today was accelerating injured person recovery and return to work outcomes through new models of care. Now, there are two words I really would like to drill down on. One is new, and the other is accelerating. So tell me about this new model and what's so new about it.
So effectively, we're building a model in which we have nurses that are very experienced, help case managers support injured people that are particularly complex from a medical perspective and from a psychological perspective. We know that the role of the case manager has a lot of demands on it, and they don't typically have the time. They may lack the training to be able to do that work effectively, and this is where the nurses come in. That's the new component. And then the accelerated component comes into the outcomes that we've been able to demonstrate early on. The model takes a lot to be deployed. There's a lot of change management involved, but when it works well, it accelerates recovery to work.
Now, nurses, talk to me about that. Why have you chosen nurses as a key component of delivery?
There's probably an element of bias because I'm a nurse by training myself, but I think it comes down primarily to the fact that nurses have a broad skill set. They're good at connecting with people. They're good at minding or helping with the psychosocial aspect of things, but of course, they're also medical experts as well. The key point of the model, though, when it comes to nursing is that ability to build trust that allows them to get to the bottom of the issues that are really keeping people from getting back to health and getting back to work.
Now, tell me a bit about the model. How does it work?
So effectively, we when somebody files a claim, we put them through a risk stratification process in which we identify, is this person risky enough? Could they have, do we expect that their claims are going to potentially be complicated? And if the answer to that is yes, according to the mechanisms that we utilize, and that is heavily driven by data science, then we recommend that they join the nursing program. And then what happens is that a nurse will engage with that injured person. They'll put them through a very detailed assessment process. We will focus on any immediate needs that they have. If they need to see a GP, if they need better pain management, if they don't yet have a definitive diagnosis, working on that diagnosis, then ensuring that that person is receiving treatment that is appropriate for their medical condition, and then identifying any additional issues that could get in the way of recovery and effectively helping remove those barriers. So I think that's, in a nutshell, the model of care.
And what sort of results are you seeing?
So we've seen some pretty impressive results. We tend to look at results through the lens of injured person satisfaction, the actual clinical and claims outcomes, and also cost savings as well. From a satisfaction perspective, we're seeing an NPS of plus 75, which is pretty impressive. And then from a getting people back to health and back to work perspective, people are coming back to work weeks, if not months, sooner than they otherwise would have. If they hadn't participated in the program. At least that's what our analytics tells us. And then the last bit, which is also important, is that there's some pretty significant cost savings that we've been able to demonstrate using QBE data specifically.
And the future for the model, how's it looking, Cassie?
The future for the model is I would say bright for us. Excitingly, there's probably 4 things that we're going to be focusing on. So we're looking at value-based contracting, provider partnerships, and more specifically, provider contracting, healthcare ecosystem development, which is going to be key to make sure that we've got that connectivity across all of the different stakeholders in that journey. And we really want to make sure that obviously incentives are aligned not only for the injured person, from the insurer for the provider, but for the hospital, because at the end of the day, what we're doing is patient-centered care and making sure that we're providing the best recovery outcomes for that injured person. And lastly, and I know we had a session on it earlier this morning, but the power of AI and automation, and what does that contribute?
Well, it sounds very exciting, very innovative. Happy anniversary, 5
you.
years, and here's to another 55
Oh, yes, and more.
and more. And congratulations on a great session.
Thanks so much.
Thank you so much for your time.